The drugs on the streets are getting stronger, and what that does to cognitive capacity. If there's brain damage involved, people may recover from their addiction, hopefully, but then now they have these comorbid cognitive deficits that, how do you navigate that? But to flip all those policies inside out, so funding was more contingent on how many people that got housed or how many people that went back to school or returned home. If the dollars were attached to incentives that had a different outcome, we could probably pivot some of the outcomes that we're seeing.
For Rebel News, I'm Tamara Ugolini here in Oshawa, Ontario, in the downtown core, where it has been plagued with public disorder, public displays of drug consumption, open-air drug use, and general safety concerns by the community as homelessness and open-air drug use proliferates in the area. I'm joined here by an anonymous guest who has a PhD in rehab sciences, a postdoctorate in public health policy, very familiar with all levels of government grant funding practices, and critical appraising and critiquing of said grant funds and applications. Before we get into the interview and some of the topics around the ideology of harm reduction and safer supply, why is it that you have to be, or that you prefer to be, anonymous in this interview today?
I think mostly because the topic is so polarizing. You're seen as being in one camp or another, and there's really nothing in between. And there's so much animosity and negativity directed towards both camps. I try to just keep an open mind and stay more central and, have the purview of there is no one right answer, especially with a wicked policy problem such as this. It's so intertwined that if I do speak freely, because I do lean more towards recovery-oriented practices, I would be blacklisted, potentially targeted by advocates who are, very much for safe supply or one narrow perspective of harm reduction. So it's just safer for me to stay anonymous because I still want to advocate for recovery-oriented services. I think when people who advocate for harm reduction hear, oh, you're an advocate for recovery-oriented services, it's one or the other, when really they all need to be integrated and work together, not at the expense of one another, but in a more coordinated fashion.
And as someone who has familiarity with public health policy, what are you seeing as the biggest or the leading failures of this harm reduction, safe supply ideology and subsequent policy?
I would say the number one, and I would call it a failing in my opinion, is when you evaluate public health policy, you look at multiple stakeholders. So you look at service users, you look at service providers, you look at the community, you look at politicians, you look at our first responders, and you gather perspectives from all of these, different people who are players in the game. And from what I've seen with most of the low barrier harm reduction interventions that are funded primarily through the federal government, it relies a lot on self-report. So the social services don't do a comprehensive evaluation of their services. They don't take a whole community approach to understanding the impact of those services when they kind of just land in a community. And oftentimes community members don't have a voice. So even though they lodge complaints or, alarms are raised and there's red flags, there's no avenue for that to be heard. It's often shut down as being, labeled as NIMBYism, stigmatizing people, discrimination, and those are all hard stop words. So it closes a conversation and the community has no avenue to be heard. So the wraparound services, from my perspective and what I've seen, being around downtown Oshawa, is that it's really nice to say you have them. They may be present, but the extent to which they're integrated is questionable, as well as the intensity of them is questionable. So it's one thing to say that you have a mental health worker on staff or a social worker or, somebody representing ODSP services. If they're there, that's wonderful, but how intensive is that service? How extensively are they able to work with clients on a one-to-one level, and for how long? What's the duration? Did they just hook them up with the service and say bye-bye and they're written off? Is there follow-up? So those kind of factors don't really seem to come into play.
Mm-hmm. One clip that I always come back to, I think it was approximately last year, with the former addictions and mental health Member of Parliament, Carolyn Bennett, when she became so unhinged in the House of Commons, screaming that harm reduction and this idea of safer supply was evidence-based and based on best practice.
Mr. Speaker, we are pretty fed up with this fight against evidence-based programs that actually are saving lives. We cannot allow the Conservatives to take us back to the failed ideology of the past. Even Harper's advisor, Ben Perrin, thinks they're speaking nonsense. So just stop it and save lives.
And you've shared today through lengthy discussion that that is not the case. What is happening here with the purported evidence that claims to support these policies?
Yeah, I think, safe supply is a bridge. It's a component. A lot of what we're modeling our interventions on are from the Portugal model, but we didn't integrate the full Portugal model. We picked the low-hanging fruit, what was easy to implement, what was easiest to integrate. So when you piecemeal something like that, it's obviously not going to be as effective as the entire model. And one would argue we don't have the funding, we don't have enough recovery-oriented services to provide that to people who need it. So the safe supply is a bridge, but what I've seen in safe supply on the streets in downtown Oshawa, there's one individual who has been here for a very long time, and she started out, as a lovely young lady, maybe about 160 pounds, and in the last 3 to 4 years, we've watched her deteriorate to the point where she might be 60 pounds right now. She can't finish a full sentence. She can barely walk. She can barely stand. She's got complicated health issues, but we're keeping her alive by providing her with clean needles, and I just wonder at what point do we evaluate the long-term effects of repeated naloxone use, of the drugs on the streets are getting stronger, and what that does to cognitive capacity. If there's brain damage involved, people may recover from their addiction, hopefully, but then now they have these comorbid cognitive deficits that, how do you navigate that? So I just think the pendulum has swung too far, relying too much on the harm reduction strategy without the other pillars being implemented and giving people hope and opportunity. And I do feel it's quite, we're infantilizing people by saying, oh, you're addicted and it's so, you're hopeless, and, we know it's hard and the struggle, and, here's some safe supply, and just when you're ready for change. And I just wish we took the approach that, no, you're better than that, we're better than that, let's help each other. I see a future for you, and it doesn't involve drugs, so let's get off drugs now. And what do you need? How can we support you? Mm-hmm.
When you talk about the other pillars, what do those look like?
It's the integration of all the systems, because you have your community safety, which involves, policing, crime and corrections, because there are certain acts that are illegal for a reason, and keeping the community safe has to be monitored and prioritized. Housing and getting people into permanent living situations where they feel safe and are safe. Healthcare, a lot of, comorbid issues come with addictions, mental health problems, like I said, the cognitive impairments, and that sort of thing. The argument is, oh, chicken egg, is it housing first or is it, addictions first? And I really think that it has to be a combination of the two, because without the right supports, both will fail. So it's how do we integrate our services and policies so that people do feel safe in a place where they can call home and feel like they're in a home, but also provide them with the supports that they need to help with their addiction. So just sticking people in a house, and then they have their friends over and they continue drug use, there's no incentive to quit, and then it spirals, the landlord evicts them. Like, that's not an effective solution. But, forcing somebody to be clean and sober before they can have that safe home environment might not be the best approach either. So it's like, how do we all work together and on an individual level? Because not every, solution is going to be a blanket cookie cutter solution. So looking more at that individual at that time, what supports would they benefit from, more, and what would lead to a more successful path for that individual?
Mm-hmm. In terms of the peer review process and the evidence-based approach that, you keep hearing, this is best practice, this is evidence-based, it's peer-reviewed. As somebody who can be critical of that process, the peer review process, what have you seen that concerns you in that space?
Yeah, because that's one of the hard stop words that kind of irritates me is people try to shut people down by saying, oh, it's, gold standard is peer review published, so you're not allowed to challenge it. But, in the academic circles, peer review is under criticism right now. There's a bunch of publications that are basically essentially saying it's not exactly what the perceived notion of peer reviewed is. There's ranking in journals, so depending on their impact factor. So the more rigorous the journal, the higher the impact factor is. So journals are ranked according to how long it takes to get something published, how rigorous it's reviewed. So an impact factor 4 and above is typically a decent and respectable impact factor, and anything below that is seen as, kind of like substandard. And there are publications from, harm reduction that falls in the extreme camp that do fall below, the impact factor of 4, but they can basically say, well, it's peer reviewed and published, so you can't challenge it. But there's a lot of loopholes and biases even in the peer review process. Disclosure issues, people have conflicts of interest that aren't disclosed in this research. The impact factors of the journals need to be considered. Yeah, so a perverse incentive in policy is basically when an intended policy, when a policy is intended to make a change in a certain direction and it actually causes the unintended consequence of the opposite direction. So, for example, a lot of social services and a lot of harm reduction is funded through demonstrating demand and showing need for services. So, hypothetically, if I said, oh, we had, 75 people come to pick up clean needles and we need more needles, so then, you get funding for additional needles. Well, what you're really doing is promoting the use of needles and, getting funding for needles. So I've always advocated, which I know it's not simple and clear cut, but to flip all those policies inside out, so funding was more contingent on how many people that got housed or how many people that went back to school or returned home. If the dollars were attached to incentives that had a different outcome, we could probably pivot some of the outcomes that we're seeing. I would say everybody has to get away from this polarized black and white thinking, where it's one way, it's this way. We have to look at how integrated the systems are, how complex it is, and try to get more comfortable in the gray area. And I know policy is there for a reason, and so there's certain standards and guidelines and people can follow it, but the issue I have right now is the policies we have aren't even being evaluated properly, so we don't. You can say, oh, we have this policy, that policy. Well, it's futile because we don't know what the policies are doing. They're not being evaluated. So we're kind of already comfortable living in the gray zone. So just to maybe, work together more and not, steep your opinions and your ideology in one camp, and to keep an open mind and look at different perspectives, different experiences.
Displays of public disorder and chaos are plaguing cities and towns all across the country. We have been reporting extensively on this at fixourcities.com. If you want to find out more, you can head over to that website, sign our petition, sign up to our emails, and consider chipping in if you can to support our on-the-ground journalistic efforts. All of that at fixourcities.com.